Good afternoon, everyone. It is indeed a pleasure to be here with you today as we talk about the state of Black health in America. There couldn't be a more timely topic, really a topic that never should be off of anyone's agenda, especially as health professionals, as policy leaders. And so we're looking forward to having a very vibrant conversation today, and one that is focused not just on research, but also on action, which I know is a primary concern for the Congressional Black Caucus. And I want to thank the Congressional Black Caucus for putting on this great opportunity along with the National Minority Equality Forum. And thank you so much, Congresswoman Kelly, for your leadership on this issue. Now, we're going to get right into the conversation. We have two experts who are not only practitioners, but they are policy experts. They are in the field every single day working on the state of Black health. And so I'm going to give very short bios. Please, I encourage you to view their entire bio online. And let me just say, this will be an engaging conversation. Now, my mother was a school teacher, as was my dad. So I believe in classroom participation. Okay, everyone? Okay, so get your questions ready because we're going to make sure that there's enough time for you to engage with the panelists as well. So first, we have Dr. Ophelia Ernest, who is the Divisional Senior Vice President of Health Care Delivery and the Chief Medical Officer for Blue Cross and Blue Shield of Illinois. She oversees strategic direction of Blue Cross and Blue Shields of Illinois' network development and management, leading a team that works with nearly 65,000 network providers and 1,000 network facilities. Her team is responsible for providing relationship, connectivity, and engagement, and also as the chief medical officer, she also ensures that the company's she serves, as the company's chief physician representative to help ensure effective and efficient delivery of quality medical care. Dr. Ophelia Ernest. Thank you. Thank you. And next we have Attorney Daniel Dawes, who is a healthcare attorney and the Executive Director of Government Relations, Health Policy, and External Affairs at Morehouse School of Medicine in Atlanta, Georgia. In addition, Attorney Dawes is a lecturer of health and policy at the Satcher Health Leadership Institute, Senior Advisor of Health Policy for the Transdisciplinary Collaborative Center on Health Disparities Research. I hope that has an acronym. Goodness. And holds a faculty appointment in the Department of Community Health and Preventative Medicine. Please, let's welcome both panelists today. So, there are a number of priorities that the Congressional Black Caucus has set out as it relates to addressing health disparities in our country. And I love that one of them is making sure that we can work to achieve health equity in a generation. This is an issue that while we need to be long-term looking, we need to be immediately focused on solutions and what we can do now to make sure that we close the health disparities gap in this country. So we're going to have presentations by our two panelists to give information about their area of expertise, and then we will go into questions and then questions from the audience. So first, we'll have Dr. Ernest. We'll begin with her presentation.
Thank you for that wonderful introduction. Congresswoman Kelly, thank you for inviting me and team. I know how important the team is, so I have to certainly acknowledge the team for this nice event. And thank you all of you for allowing me to be here today. We're going to just start out with the very obvious truth is that the conversation is about the town hall discussion of the state of Black health. And I work for Blue Cross Blue Shield of Illinois. And this is a journey for us. So the content that I'll be sharing today is really sharing our journey because we're on a journey in terms of how we improve the health of our communities in general. And this has been a big part of, I joined the